Nồng nhiệt chào mừng quý vị đại biểu, các vị khách quý đã tham
Ladies
dự.
and gentlemen, we'd like to warmly welcome all of you to the kick-off ceremony for the project Responding with Essential HR Provision and New Delivery Mechanism RESPONS project from the MSI Reproductive Choices in Vietnam. On behalf of the Board of Organizers, I would like to wish you all good health, ladies and gentlemen.
Ladies and gentlemen, warmly welcome all of you to the kick-off ceremony of the project Responding with Essential SRHR Provision and New Delivery Mechanisms Respond today. On behalf of the organizers, we would like to wish you all the best with health and happiness.
Kính thưa quý vị, dịch bệnh
Ladies and gentlemen, COVID pandemic has generated lots of burden for the Vietnam health sector. Especially, it impacted a lot on the vulnerable people, including women, people with disability, and the GBV victims. So with the MSI, we estimated that in 37 countries where we are working with the lack of services for the people in COVID time, it can increase to many cases of unexpected pregnancy or unsafe abortion. This has been resulted from the lack of services during the COVID pandemic, with loss of resources mobilized for the pandemic prevention. And in Vietnam, according to the UNFPA, in 2020 to 2021, the lack of family planning services has generated a lot of difficulties, and there's a lack from 6 to 12% of the services needed for the reproductive women age, and especially for the people aged 15 to 24.
Has a huge burden to Vietnam's public healthcare system, particularly cause serious impact on healthcare of the vulnerable groups, including women, people with disabilities, and victims of sexual-based violence. MSI's global focus that in the 37 countries where we operate, the shortage of reproductive healthcare and family planning services due to COVID-19 could increase by 3 million unintended pregnancies, 2.7 million unsafe abortions, and 11,000 pregnancy-related deaths. This consequence is directly caused by social distancing. Public health facilities are mobilized to fight epidemics and vaccinate, while many non-public medical facilities have to close and restrict travel. In Vietnam, according to data from the United Nations Population Fund, in 2020 to 2021, the shortage of family planning services has increased the unmet need in the general community from 6% to 12% in the group of women of reproductive age from 15 to 49 years old. Especially this rate is 40% among young people from 18 to 24 who are unmarried but sexually active.
Kính thưa quý vị, không những vậy,
Ladies
COVID-19
and gentlemen, COVID also further worsen the GBV and the DV. According to the CWD and the Women's Union, in the first 6 months of 2021, the hotline for GBV victims have received more than 1,300 calls, 40% increase compared to previous year, and many of them, like more than 80%, related to the GBV COVID pandemic. Especially the situation has led to many more difficulties for the GBV survivors in seeking for support.
Domestic violence and gender-based abuse. According to statistics from the Center for Women and Development, the Vietnam Women's Union, and the first 6 months of 2021, the hotline for sexual gender-based violence support received more than 1,300 calls, an increase of about 140% compared to 2020, of which 33% of calls were related to domestic violence. And COVID-19, and especially the state of social distancing, have made it more difficult for victims of sexual and domestic violence to find support.
Do vậy, dự án phản ứng nhanh với đại dịch COVID
That's why the project RESPONS was developed with the objective to reduce the impact of COVID pandemic-19 for women through different interventions, innovations, and focusing on the needs of the female workers, women in the rural area, and the GBV ones. The project focused on the reproductive health care and reduce violence, focusing on the female workers, women in rural area, and we tried to create a safe network for the people, and we can seek for more clients to support better health care for women.
Project responding with essential HR provision and new delivery mechanisms respond was built with the goal of reducing the impact of COVID-19 pandemic through innovative interventions that focus on the special needs of female workers, rural women, and victims of gender inequality. Priority of project is to increase access to reproductive health care, reducing gender-based violence for women and men in Vietnam, focusing on factory workers, rural women by creating a network sustainable reproductive health care is accessible to customers with the potential to extend women's health more broadly.
Tiếp theo chương trình, thay mặt cho ban tổ chức, tôi xin trân
Continue on behalf of the board of organizers, I would like to introduce to you, ladies and gentlemen, our distinguished guests.
Introduce the delegates and distinguished guests attending the event this morning.
trân trọng giới thiệu ông Phạm Việt Dũng, Chủ tịch Liên đoàn Lao động tỉnh Thái Nguyên.
Please welcome Mr. Phạm Việt Dũng, Chairman of Thái Nguyên Federation of Labor.
Xin trân trọng giới thiệu ông Phạm Hoàng Hải, Phó Giám đốc Sở Lao động Thương binh Xã hội tỉnh Thái Nguyên.
Mr. Phạm Hoàng Hải, Deputy Director of Labor in Values and Social Affairs.
Xin trân trọng giới thiệu ông Trần Quốc Trung, Phó trưởng ban quản lý các khu công nghiệp tỉnh Thái Nguyên.
Mr. Trần Quốc Trung, Deputy Head of Management Committee of Thái Nguyên Industrial Park.
Cùng các đồng chí lãnh đạo đại diện cho các cơ quan Sở Y tế, Sở Ngoại vụ, các đồng chí thường trực trưởng phó ban Liên đoàn Lao động tỉnh Thái Nguyên, trưởng phó chủ tịch công đoàn cấp trên cơ sở và đại diện một số doanh nghiệp có đông lao động.
We also would like to welcome representatives from Provincial Department of Health, Department of Foreign Affairs, Department of Planning and Investment, Department of Labor in Values and Social Affairs, Chairman and Vice Chairman Federation of Labor and Trade Unions at all levels, and trade unions from factories operating in the province.
Về phía tổ chức MSI tại Việt Nam, xin trân trọng giới thiệu bà Nguyễn Thị Bích Hằng, trưởng đại diện tổ chức MSI tại Việt Nam.
On the side of MSI Vietnam, we would like to welcome Madam Nguyễn Thị Bích Hằng, Country Representative of MSI Reproductive Choice in Vietnam.
Thông qua nền tảng trực tuyến, chúng tôi xin trân trọng giới thiệu sự hiện diện của nhà tài trợ từ Bộ Ngoại giao và Thương mại Úc. Xin được chào đón bà Maidie
And we
Holden.
would like to introduce DFET, Miss Maidie Holden, the first secretary of the Australian Embassy in Vietnam.
Through the online platform, we are pleased to introduce Mrs. Maidie Holden, First Secretary Development Corporation, Australian Embassy, Vietnam.
Xin được chào đón đại diện từ văn phòng MSI UK.
Representative from MSI London office.
Xin được chào đón đại diện từ văn phòng MSI Úc.
Representative from MSI Australia.
Quý vị đại biểu từ các sở y tế, chi cục dân số, Liên đoàn Lao động, các nhà máy tại 11 tỉnh địa bàn dự án đang thực hiện cùng hệ thống phòng khám sản phụ khoa. Các đơn vị tổ chức quan tâm đến dự án thông qua Zoom và mạng xã hội.
And please welcome representatives from Department of Health, Department of Population and Family Planning, Federation of Labor, factories in 11 provinces in the project area, as well as private clinic network and many others.
Và xin được chào đón quý vị đại diện các cơ quan thông tấn báo chí đã đến tham dự sự kiện này. Xin trân trọng cảm ơn quý vị đại biểu khách quý đã dành thời gian tham dự sự kiện ngày hôm nay.
And we also would like to welcome media and press agencies for being here with us today. Once again, thank you so much.
Vâng, và ngay sau đây tôi xin kính mời bà Nguyễn Thị Bích Hằng, trưởng
Now I
ban
would like to invite Miss Nguyễn Thị Bích Hằng, the country representative of MSI Vietnam, to have an opening remark, please.
Xin trân trọng kính mời.
And now please welcome Madam Nguyễn Thị Bích Hằng, country representative of MSI Reproductive Choice Vietnam, to deliver the opening remarks. Please warmly welcome her.
Dear Mr. Phạm Việt Dũng, the chairman of Thái Nguyên Federation of Labor. Dear Ms. Mighty Horden, the first Secretary of Development and Cooperation from the Australian Embassy in Vietnam, dear leaders from Provincial Doliza, Department of Health, and relevant agencies, dear distinguished guests and online participants, dear representative from the MSI London office and the Asia Pacific region, and all of our partners who are joining the kickoff ceremony today. I am so impressed that now the technology has done a lot. We can have a kickoff meeting to start the cooperation relationship within the RESPONS project with all the partners, not only in Vietnam, but also in many other countries. Today is my great pleasure, and I'm so happy to join the kick-off ceremony for the project responding with essential SRHR provision and new delivery mechanism, the RESPONS project in short. The project is funded by the Department of Foreign Affairs and Trade, DFAT, from Australian government. The COVID pandemic has severely damaged the society, and as we have listened to the two MCs, MSI forecast that in the 37 countries where we are working, the integration of the healthcare, especially reproductive healthcare and family planning due to COVID-19 can increase by 3 million cases of unexpected pregnancy and 2.7 cases of unsafe abortion and 11,000 death case related to pregnancy. This consequence has directly generated due to the social distancing or lockdown, because you know the public health facilities are all mobilized for the COVID prevention and for vaccination, while the non-state or the private health facilities had to close due to the travel restrictions. And these situations can be largely addressed if the whole government system, the enterprises, the donor, and the community all have a strong will to work together with the service providers in the SR8 in order to provide the simple solutions, the effective solutions, which have been proved to save lots of life. The pregnancy avoidance and the termination of unexpected pregnancy are all necessary and essential healthcare services. And in Vietnam, according to UNFPA, we see that in the period 2020 and 2021, the lack of the planning services has increased the unmet needs from 6 to 7% to 12% among the women of the reproductive health age, which is 15 to 49 years old, and especially this rate is increased by 40% among the youth people aged 15 to 24 who are unmarried, who are having sex. The health of the woman and the life of the woman are being put at risk because many health facilities have to stop providing services, especially the reproductive health care and the planning, family planning services. And according to the UNFPA, the expected or the estimated rate of the maternity mortality has increased from 44% to 65% during the COVID pandemic. The reason was from the lack of services or the limited access to the healthcare services for mother and children, as well as the lack of access to the essential family planning services. And women always need to receive support in healthcare, and during COVID lockdown or restriction, we see that many GBV and DV people they called a lot of calls to the hotline for GBV survivors, and we see that the rate of the calls to the hotline increased by 140% in 2020, which is 83% of which comes from the calls related to the domestic violence, DV. So we see that the situation is severe, so we need to do something to address the situation. COVID pandemic also led to the disruption in the supply chain for the essential healthcare services for women, and the pandemic has generated lots of severe consequences like disruption in the healthcare services, especially the reproductive healthcare and family planning services due to the lack of healthcare workers or equipment or the contraceptive measures. And also the resources for the family planning is reduced, and the life and the future of many women can be put at risk. Given that MSI has been working in many countries in the world, and we are trying to provide the essential reproductive health care services to the women. In Vietnam, together with 8 regions in the Asia and Pacific region, including Bangladesh, Cambodia, Nepal, Pakistan, PNG, Timor-Leste, Fiji, Myanmar, and MSI Vietnam, we, together with local partners, implement the project responding with essential SR-HR provision and new delivery mechanism. In short, it is the RESPONS project. The major objective of the project is to provide services so that people can get access again to the service like before the COVID pandemic. And also this is an opportunity for us to find new approaches, the better mechanism to provide information about the reproductive health care education, as well as the new mechanism for service provision, which is suitable to the new normal after COVID pandemic. Since 2005 until now, MSI Vietnam has lots of experience in collaborating with big brands like Adidas, New Balance, Levi's, Chanel, Apple, or Poche Vietnam, Crystal Martin, and many other suppliers of the big brands like that in the world who work with the big donors and famous donors in the world like the European Community, World Bank, or Canada government, and especially Australian government. So in order to implement the programs to raise awareness and to educate people and to provide reproductive healthcare services for the people, especially the workers in many industries in Vietnam. I hope that Taiwan Federation of Labor within the project of RESPONS, as well as in other areas, we can open a new model, we can introduce a new model to provide a service in a way that we bring more knowledge and information, we bring more services options to the workers in Taiwan Industrial Park, as well as in other project locations. I also hope that MSI Vietnam, together with Taiwan Labor on Taiwan Federation of Labor, we can learn precious lessons from developing the partnership relationships in sharing values with the enterprises for the benefits of the workers and the enterprise in order to contribute directly to the local development and local economic development in developing the community which is united, reliable, and harmonized. So once again, I would like to thank you all, ladies and gentlemen, even though you are very busy, you still spend time joining this very important event today. We are looking forward to further meeting and working directly with you in the future in implementing the RESPONS project, which is funded by the DFAT from the Australian government. I'd like to thank you for the just and the precious financial support from DFAT for RESPONS project. And I'd like to wish all good health and happiness. And especially, I wish all the enterprises, you can overcome difficulties and you can gain good business performance in 2022. Thank you very much. Thank you, Ms. Nguyễn Thị Bích Hằng, for your very meaningful sharing.
Madam Nguyễn Thị Bích Hằng for your sharing.
Ladies and gentlemen, the RESPONS project It's implemented from August 2021 to July 2023 in order to increase the access to information and services in SRH in 4 provinces, Hà Nội, Thái Nguyên, Đồng Nai, and Bình Dương for the workers there, and for the rural women in 7 provinces of Hậu Giang, Bình Phước, Phú Yên, Lâm Đồng, Đắk Lắk, Sơn La, and Lào Cai.
Ladies and gentlemen, RESPONS project is implemented from August 2021 to July 2023 with the goal of increasing the use of information and high quality and equal reproductive healthcare services for workers in 4 provinces, Hà Nội, Thái Nguyên, Đồng Nai, Bình Dương, and with women in rural areas in 7 provinces, Hậu Giang, Bình Phước, Phú Yên, Lâm Đồng, Đắk Lắk, Sơn La, and Lào Cai.
Hôm nay chúng tôi rất vui mừng và vinh dự được hợp
We
tác
are
và
very happy today to conduct the kick-off ceremony, and now may I invite Mr. Phạm Việt Dũng from the Thái Nguyên Federation of Labor to give an opening remark.
And hold the project kick-off ceremony in Thái Nguyên province. And now, may I invite Mr. Phạm Việt Dũng, Chairman of Thái Nguyên Provincial Federation of Labor, to deliver the opening remarks. Please welcome.
Dear Miss Maidi Horden, the first Secretary Development and Cooperation from Australian Embassy in Vietnam, dear Miss Nguyễn Thị Bích Hằng, the country representative of MSI Reproductive Choices Vietnam, ladies and gentlemen, currently in Thái Nguyên area, there are around 230,000 workers, in which Thái Nguyên Federation of Corporation, Thái Nguyên Federation of Labor, we are managing directly 155 youth members in the trade union. We see that the COVID pandemic has impacted severely on the social economic condition in the country, especially the health and the life of workers. Given that, with the concern and support from the DFAT and the MSI Vietnam, we have paid attention to support the workers in Vietnam to implement the project called Responding with Essential SRH Provision and Delivery Mechanism. The project is very meaningful and it is very urgent to support the workers in Thái Nguyên in general and for the female workers impacted by COVID-19 in particular. Ladies and gentlemen, as we all know, so far there have been many studies in the world who said that the COVID-19 infected people, they are having some healthcare issues even after getting infection, especially the healthcare of both men and women. And we can see that the laborers, especially the young people, they have been lots of difficulties in accessing to services, and this has been impacting on the worker qualities in Thái Nguyên. On behalf of the workers and the trade union members of Thái Nguyên Federation of Labor would like to thank you, DFAT, for funding this project. We'd like to thank you, MSI Reproductive Choices in Vietnam, to reach and to support Thái Nguyên Federation of Labor to implement and provide services, to propagandize and to provide new knowledge and services for the workers in industrial parks, in enterprises, in factories. And based on that, we can improve the quality, the health condition of the workers. Based on that, we can increase the work or the labor productivity, which can contribute to the sustainable economic development. Ladies and gentlemen, today at this kick-off ceremony, on behalf of the workers in Thái Nguyên province, we would like to declare that we commit to work closely with MSI Vietnam to implement the project, so that the projects can be implemented deeply, largely to many enterprises on the large scale, and the workers can access to the quality services generated by the project. And also at the same time, we'd like to request that all the trade unions in the area, you can instruct your subordinated agencies to communicate and to mobilize so that the workers can be facilitated and they can enjoy healthcare services. the SRH services that the project provides, and please facilitate good conditions for the project to be implemented effectively. With that, I would like to declare the opening of the RESPONS project, responding with essential HR provision and new delivery mechanism in Taiwan. So once again, I would like to wish you all good health and wish the project successful so that the workers can benefit the very meaningful healthcare services from the project. Thank you very much.
Xin được trân trọng cảm ơn những lời chia sẻ vừa rồi.
I'd like to thank you for the sharing from Mr. Phạm Tiến Dũng.
Kính thưa quý vị,
Ladies and gentlemen, as Mr. Dũng said, COVID pandemic has impacted greatly on the social economic development situation in the local province, especially the healthcare and the condition of the workers. The RESPONS project implemented by MSI Vietnam together with IPPS, we will improve the condition for the SRH health of the workers.
Ladies and gentlemen, as Mr. Dung just said, the COVID-19 pandemic has greatly affected the socio-economic situation of the locality and the country, especially directly affecting the health and life of workers. The RESPONS project, implemented by MSI Reproductive Choice Vietnam in collaboration by MS with IPPF, will help improve the sexual and reproductive health and rights of workers, especially female workers, rural women, and victims of domestic violence.
Và như ông Dũng đã chia sẻ, chúng ta không
As
thể.
Mr. Dũng said, we have to mention the great funding from DFAT.
We cannot forget contribution from the government of Australia to funding from the Australian Department of Foreign Affairs and Trade.
Và ngay sau đây tôi xin kính mời.
And now I would like to invite Mr. Mighty Harden, the first secretary of the Development Cooperation Department from Australian Embassy, to have an opening sharing, please.
We would like to invite Mrs. Mighty Harden, first secretary in charge of development cooperation of the Australian Embassy in Vietnam, to give a speech through the online meeting platform. Please welcome.
Good morning. Thank you, everyone. Mr. Pham Viet Dung, Chairman of the Thai Nguyen Labour Federation, Mrs. Nguyen Thi Bich Hang, Country Representative for Marie Stopes Reproductive Choices, ladies and gentlemen, it's a real pleasure to join you at today's launch of the RESPONS program. Unlike other more conservative countries in the region, Vietnam has ensured accessibility to sexual reproductive health services for women. This has been maintained in policy and in funding for services, and it's reflected in the remarkable reductions in maternal and infant mortality that Vietnam has demonstrated are possible. It's not that long ago, only in 2015, that Vietnam had the distinction of being among the very few countries who met the maternal and child health Millennium Development Goals. Vietnam's policy position has literally meant that millions of women and couples in Vietnam have been able to plan their families, space their children, and receive the sexual and reproductive health care and support that they need. We know, and other speakers have mentioned this morning, that beyond Vietnam, globally, the COVID-19 pandemic has reduced access to sexual and reproductive health services and increased gender-based violence, rates of child marriage and teen pregnancy. Given these very specific challenges, Australia is delivering the Indo-Pacific Sexual and Reproductive Health Rights Program, designed to save lives by quickly accelerating access to health services and information for communities whose services have been disrupted by the pandemic. We're supporting this program in 22 countries across the Indo-Pacific. And in Vietnam, we're very pleased to partner with MSI Reproductive Choices to deliver this program through the RESPONS project. It's particularly great to see the focus on working migrant women workers in RESPONS. For many of us, the women in the industrial zones are first and foremost workers. They are part of the miraculous Samsung or Po Yuan story of Vietnam's export manufacturing sector, sites that are driving Vietnam's juggernaut growth. But we know that they are young women, the majority of whom have moved to these urban centres for their first job. their first opportunity for paid work. Many of these women come from ethnic minority backgrounds, and they've travelled a long way to both contribute to and enjoy Vietnam's economic prosperity. It might be their first time away from home. It might be the first time they've met someone and engaged in a relationship. Not every woman has access to full information about sexual reproductive health services and options available to them. And many women are not in circumstances or relationships to act upon this even when they do. So we're very pleased that MSI Reproductive Choices has chosen to concentrate support on this particular group of young women and to expand their chances of having the information, care and options that they need to plan their lives, relationships and families. I first visited Marie Stopes' Reproductive Choices project back in 2015 working in garment factories. And I was so impressed at how many young women were receiving information and access to services for the first time through this innovative approach. And the benefits reach beyond the women themselves. Employers have happier, healthier staff and higher staff retention. I'd really like to take this opportunity to highlight the important work that the RESPOND program can do to make sure that no one is left behind, by making sure that quality choices and services are made available to everyone, regardless of their differences, including people with disability. When it comes to sexual reproductive health services, we know that people with disabilities can find them difficult to access, but that they have the same needs and rights as others do in accessing those services. Equal accesses to those services can be transformative for people with disabilities. And we hope that RESPOND can make a powerful contribution to the needs of people with disability. Finally, I'd like to just offer my thanks to the RESPOND program partners. Firstly, to MSI Reproductive Choices. MSI is a highly regarded and long-standing partner of the Australian Development Program. We've worked closely together for many years in many parts of the world. The MSI team here in Vietnam is a pioneer in the Southeast Asia region, with their successful approaches developed here now being used across the region, for example, in Cambodia and Myanmar. Secondly, to the provincial labour unions, including the Thanh Nguyen Federation of Labour, thank you for partnering with Marie Stopes Reproductive Choices. Thank you for your commitment to this critical program and for recognising that support for women's health is important for a productive, happy workforce and creating better working conditions for women. Sexual and reproductive health rights remain a strong priority for the Australian government. We're committed to advancing universal access to quality sexual reproductive health care and services, and to leaving no one behind. And without question, the achievements of RESPOND will be essential to achieving gender equality, saving lives, and improving health and well-being for women in Vietnam. Thank you.
Xin trân trọng cảm ơn bà Mady Holden về
Thank
những
you,
lời
Ms. Mady Holden, for your very meaningful sharing.
Thank you, Mrs. Mady Holden, for your sharing.
Kính thưa quý vị, và bây giờ
Ladies and gentlemen, and now I think it's time for us to witness the most important moment of the today's ceremony. May I invite Mr. Phạm Việt Dũng, the chairman of Taiwan Federation of Labor.
Please welcome Mr. Phạm Việt Dũng, chairman of Taiwan Federation of Labor.
And Ms. Nguyễn Thị Bích Hằng, the country representative from MSI Reproductive Choices in Vietnam.
Country representative MSI Reproductive Choices in Vietnam.
Please come to the stage to give the cooperation agreement to mark the kickoff of the project cooperation RESPOND in Taiwan.
And two delegates will take the stage to conduct the signing ceremony for the RESPOND project. Please warmly welcome. Vâng, xin quý vị dành một tràng pháo tay thật lớn để cổ chúc.
Please give them a big applause for the cooperation between the two agencies. Now I would like to invite the two delegates please have a look at the LED screen and touch the logo of the two agencies to officially launch the project.
Kick off the RESPONS project. Please count with us. Xin mời quý vị hãy cùng đếm với chúng tôi ạ. 3,
3, 2,
2, 1,
1.
bắt đầu. Vâng, thưa quý vị, ngày hôm nay
So, ladies and gentlemen, today is a very important event to open a new roadmap for the cooperation between the two agencies, and this cooperation is promising to bring many good benefits to the community, especially to the SIH services for the vulnerable group in Thái Nguyên province.
Xin trân trọng cảm ơn hai vị đại biểu.
Thank you, the two representatives.
Thank you all the delegates.
Kính thưa quý vị, để quý vị
Ladies and gentlemen, for you to better understand the activities and contribution of the RESPONS project in providing healthcare services in Thái Nguyên province, I'd like to invite Ms. Lê Thị Kim Yến, the project director, to introduce about the project model.
Give a big round of applause to welcome Mrs. Lê Thị Kim Yến, project manager of the RESPONS project, will share with us about the detailed information of the project.
Xin kính chào tất toàn thể các vị đại biểu ngày
Good
hôm nay.
morning, ladies and gentlemen. We have witnessed a very important and touched moment, the official kick-off ceremony of RESPONS project in Vietnam. And now, on behalf of the agencies receiving funding, I'd like to introduce about the project activities. We would like to go through some parts. The first one, introduction about MSI in Vietnam, the overall picture of, or the overall context of RESPONS project, the working model and the cooperation model. Today, we have many members here with the representative from the trade union at the higher and grassroots level. So after my presentation, I hope that we can discuss further. And within the project framework, we'd like to answer as much as possible. Firstly, I would like to invite you to have a look at the video to introduce about the project. On the 21st of January 2019 in Vietnam, we had the first 2 cases of COVID-19, and since then, the number of cases increasing non-stop, and the health system is facing lots of difficulties. And at this time, Vietnam has recognized on nearly 8 million cases, 41 death cases, and the number of infection cases is highest in the Southeast Asia and ranked 15 globally. The COVID pandemic has generated lots of consequences like the disruption in the service provision and the disruption in the supply chain. According to the statistical data in 2021, we have 1.7 million people unemployed, which is 3.98%. And COVID pandemic also led to the situation or the cases where the worker have to work 3 on spot, and the workers have to stay in the factory to work, and this has led to many difficulties for the workers and the employers. And we also see the wave of workers running out of the working areas and moving back home. Given that situation, RESPONS was developed. So what is RESPONS? RESPONS was generated with a fund from the DFAT in collaboration with MSI Reproductive Choices in Vietnam, together with the federations of laborers. We want to target the work in the factories in 4 provinces: Hậu Giang, Bình Phước, Phú Yên, Lâm Đồng, Bắc Lắk, Sơn La, and Lào Cai, to support the women there too. The project was started in August 2021 and will last to July 2021. And we would like to target and support many people and workers. We hope that we can support us, for example, 60 health facilities. So sorry, the sound of the meeting room is too poor. I cannot get all information. And the project expect to reduce the mother maternity and reduce many cases of unexpected pregnancy and reduce the cases of unsafe abortion. And RESPONS expect to achieve good results in improving the right and health care to reproductive health care for the women and the workers. So with the video, it introduces the very fundamental features of RESPONS project. Why do we have this project and the main activities of the RESPONS project? Now I would like to introduce in more detail why Australian donor selected MSI to implement this project. Firstly, I would like to introduce a bit about MSI. Established in 1970 in London, UK, and it recently was changed to MSI reproductive choices or MSI recently, and its headquarters is in London, UK, and MSI focus on the reproductive healthcare and sexual healthcare and family planning. It brings more choices or diverse choices for the people. That's why we changed the name of the organization. That is, we bring more diverse options for the healthcare for women and children and the population in general. MSI operates in 37 countries, and since November 1997, we officially established the representative office in Vietnam, which is 25 years now. Our strength is that we are proud to be an organization, the biggest organization in Vietnam, with the healthcare service providers, with a network of service providers, which is very large. And we have the Dr. Marie clinic system with 12 clinics nationwide, and in Hanoi, currently we have 3 clinics named Dr. Marie. We hope that the women here, if possible, you can come and enjoy the services of Marie Stove with the support from MSI. Its name is Dr. Marie. In Hanoi, there are 3 clinics, and I am a loyal customer of MSI, of this Dr. Marie clinic. I worked in MSI since 2009, and since then, I am a loyal customer of MSI. Another reason for the donor to select MSI, as Ms. Nguyễn Thị Bích Hằng in her speech, she said already, that is, since 2015 until now, we have been collaborating with many brands and factories like Adidas, Apple, New Balance, Pouchen. We provide services of services for millions of workers, and we build a capacity for 3,000 service providers, healthcare, and we collaborated in many activities to build a capacity and improve the facilities for many public and private health facilities. And we are now having the projects to build a capacity for public health workers in some provinces in Vietnam. With this part, in the introduction by the MC and in the opening speech by Ms. Nguyễn Thị Bích Hằng, they already mentioned, so I would like to skip this slide. In 2015, MSI Vietnam implemented an independent study in 7 garment and apparel factories, and we found that the poor working conditions, such as the working in a hot environment for long hours, can many consequences. For example, 68% of female factory workers only 50% of them who got diagnosed, they visit health facilities, and the others nothing. Actually, we face lots of this situation very frequently during our health examination for the workers in the factories. For example, in the program that Ms. Mady Horden introduced to the Heinz brand factory in Hưng Yên province. Through many mobile examination, more than 90% of workers
cái số lượt viêm nhiễm đấy là mắc bệnh viêm lộ tuyến và ngay lập tức
more than 50% of them face many
đề nghị chúng tôi quay trở lại để có
situation
khám cho công nhân. Thế cho nên là cái tình trạng
with their cervicitis in the cervical atrophy. So we think that the situation happens solely in female women. And once again, one more thing is that they are lacking of the knowledge of the SRH services. That's why they use very low services, and it leads to very high unwanted pregnancy. And averagely, a worker takes up 14.8 days off per year due to the reproductive health reasons. And their salary is not enough to pay for the child services, and 40% of female workers quit their job after giving birth. And one more thing, one more important thing is that
và trên 1/3 mong muốn được là nhận cái dịch vụ đó tại nhà máy. Đó. Thế nhưng mà một cái thực tế rằng là rất ít các nhà máy, các khu công nghiệp.
But in fact, we have very few factories or industrial zones having a clinic in the factory. Especially, we see very few providing the in the factory. That's why Marisol provides services to the workers. Vietnam is one among the 9 countries selected to implement this RESPONS project. The beneficiaries of the project include women and men in the reproductive health age, including the factory workers, rural women, or GBV or DV survivors. You know that due to the COVID pandemic, it impacts a lot on the economic condition, and it impacts on many things, like children cannot go to school, they have to stay at home, and it can lead to negative impacts on the spirit, on the mental health of women, and it can lead to increased gender inequality. The project also focuses on the health care for the people with disabilities. In the introduction that you have seen from the video, there are some expected overall, and I would like to focus on Thái Nguyên province only. We have a very good news that initially the project covers 8 provinces having the factories, but recently, due to the rapid response, now we would like to focus only on 4 provinces: Hà Nội, Thái Nguyên, Bình Dương, and Đồng Nai. That's why our number of beneficiaries in Thái Nguyên will be increased like 3 times or 4 times higher. So the beneficiaries in the province is increased. And the project also provides necessary products to the health facilities of the factory. Similarly, the number of workers accessing to information and documents can be increased too. In the video, we also see thoroughly the project major activities. And now, I would like to focus on the communication activity. So, you have the QR code in front of you. That's the QR code that you can scan and you can access to the documents. And
và tất cả những cái tài liệu truyền thông, thông tin về truyền thông chúng tôi sẽ được đưa lên cái trang web đấy. Và khi mà công nhân,
so we have provided all the documents on these areas, and we put everything through this QR code. And when the worker they scan this QR code, they can access to a lot of documents. So please have a look at the screen. We can see how we can access to this website.
Vâng ạ. Chắc là quý vị đang có sự trải nghiệm là tiếp cận vào các cái video
So
truyền
I
thông.
think you are trying to access our communication videos, right? On the standees that we see outside and even inside this room, we see this QR code. This QR code are for the workers. So on the screen, this is the instruction to use the QR code. So whenever the workers, they scan this code and they can access and they get the code. And when they declare information like their name, their age, their factory, their worker code, then after they send that registration, there will be an e-voucher code sent to their phone number, and they can use that voucher code to the events like the healthcare events, then they can receive following healthcare services. And I think you are interested in this, right? When they join, what are the things they can benefit when they join our project? With initially we expect to target 2,200 workers to receive these services, but now the number is up to 6,000 or 7,000 workers. They can enjoy the gynecological examination, early cervical cancer screening, or gynecological ultrasound, and a giveaway gift valued to 500 to 600,000 VND. All of this fee, the fee for the examination package is totally free for the workers. And also we see some images of the events or the services provided by MSI or Maristock. In addition to that, through the online checkup at the factories, we see that the needs of the workers, after they see that they have some disease, they do not know how or where to get services. And we provide very good very good services for them, like with the price reduction of 20 to 50%. This is to serve the real needs of workers whenever they detected any disease. So they also expect to treat that disease, right? Next one, when we provide healthcare services for the workers, then what are the benefits? It can lead to the reduction in the absenteeism and turnover rate, and we can increase the productivity. We can prevent costs incurred by unintended pregnancies and reproductive sickness. We can also improve worker satisfaction, and thus they can have higher commitment to the factory. And also we can improve the relationship, the linkage between the employee and employers. These are other benefits for the workers. Workers can prevent unwanted pregnancy. Workers can receive SRH services, and they can prevent and they can receive online treatment for gynecological disease and sexual transmitted disease. And the services can be guaranteed because MSI can have the global standard services. And they can also enjoy the free or preferential price from the donor, from the project, because we receive funding from the donor. So these are some benefits for the different agencies, including the trade unions. So, firstly, let's talk about the cooperation mechanism. Well, we see that the Federation of Labor, when you join the event today, it shows the strong collaboration between the MSI and the Federation of Labor. And the Federation of Labor has shown a very important role in the project coordination. I'd like to go deeper into the responsibilities of the Federation of Labor at senior and lower levels.
để mà tham gia cái chương trình này,
The
cũng như là cử
Federation of Laborers, they will also, they will introduce,
triển khai các cái hoạt động
they will
và
select
thường là cái nhân sự
and
của công
introduce
đoàn
companies
phải
and factories
và
where the
tạo điều
majority of
kiện
female
cho
workers
nhân
are
viên y tế
working
nhà
and are
máy
willing to
tham
cooperate
gia
so
vào
that
cái
the
khóa
programs
tập
can
huấn
be
nâng cao
implemented. They will
dạy
also
bảo bao gồm
coordinate
cả trực
the
tuyến
project
và
staff
trực
to
tiếp.
implement the
Chúng tôi cũng
activities,
có những cái
and they
chương trình
will
đào tạo cho
facilitate
nhân
the
viên y tế của nhà
factories
máy ạ.
staff to participate in the project
Phối hợp
capacity
với
building
dự án này tổ chức
activities
các cái đợt
like
cung cấp dịch
online
vụ
and
khám phụ
offline
khoa,
trainings.
truyền
And
thông nâng cao
they
nhận
will
thức
also
trực tiếp
coordinate to
hoặc
the
thông
project
qua các
to
nền tảng xã
organize
hội.
the
Thì trước đây chúng tôi cũng có rất nhiều những cái cuộc
there are also some communication activities to raise awareness directly or through social platforms. Previously, we conducted a lot of in-person communication events, but now due to the restriction in COVID situation, we changed to the online communication, and the effectiveness remains the same. And also the Federation of Labor also received the products for the right purposes. Let's talk about the responsibilities of MSI. We have seen the cooperation of the two parties. Then MSI have to be responsible for managing the funding from the donors as per the commitment with the donors. And every 6 months, we will share with you the results achieved in the province. I would like to also introduce a bit more about different components on capacity building training. Within this project, the factories health workers will be trained on how to reach the survivors or the victims of GBV or DV. And also they will be trained on how to treat equally with the people with disabilities. And at the same time, we also provide the hotlines so that the sexual violence victims and GBV survivors can have access to timely support. And as we presented before, when the workers come there to receive services, we work with the brands to have a small gift or tokens for them. So when they come to use the services, they are very happy. And now it's time for Q&A. We hope that, ladies and gentlemen, if you see any issues or any questions after listening to my presentation, then please raise your voice. And we have Ms. Nguyễn Thị Bích Hằng, the country representative of MSI Vietnam, and I am the project director. I will answer your questions. And finally, I would like to wish you all good health and wish the workshop successful nationwide as well as in Thái Nguyên province. Thank you very much. Thank you, Ms. Lê Thị Kim Yến, for sharing very detailed and meaningful information about the project activities. Through the information, I'm sure that you understand more about the priorities and vision and mission of the project. Now I'd like to invite Ms. Vũ Thị Phương Hảo, the Vice Chairman of the Federation of Labor of the Industrial Park in Thái Nguyên, to have some sharing.
Mrs. Vũ Thị Phương Hảo, Vice President of Thái Nguyên Industrial Park Labor Union, to go to the stage and share some thoughts about the project.
Vâng ạ. Xin kính thưa đồng chí Phạm Việt Dũng, Ủy viên Ban
Phạm Việt Dũng, the Chairman of Thái Nguyên Federation of Labor, dear Ms. Mai D. Harden, the representative from the DFAT, dear Ms. Nguyễn Thị Bích Hằng, the Country Director of MSI Project in Vietnam, ladies and gentlemen, Thái Nguyên Industrial Parks, we are managing nearly 100,000 workers. 64% are women. Most of the workers in the area, in the industrial zone, are at the reproductive health age. COVID pandemic has impacted a lot on the life, the job, the income, and the health of the workers, especially the IT industrial park workers. Their life is very difficult. Many of them come from the mountainous and rural areas. In just 2 months in 2022, nearly 10,000 female workers who are pregnant and having kids under 6 years old contracted COVID-19, and they also receive support from the trade unions in the factory and the IP. These are the persons who need support in healthcare. The implementation of the MSI project in Thái Nguyên is very meaningful, and it is a very good opportunity for the workers to access to more healthcare and reproductive healthcare services as committed by the project. From the Thái Nguyên Federation of Labor, we hope that through the project, workers in Thái Nguyên, they can receive the most benefit from the project, and we will advocate and mobilize our grassroots trade union and the Federation of Labor to join the project activities. And we hope that the leaders from the province, the leaders from the Thái Nguyên Industrial Park, the leaders of different agencies joining the project can facilitate the project activities. And we also hope that with all the leaders and the project staff, we can have a very successful activities to support the workers. I'd like to thank you very much for the funding and the support from the DFAT. And I'd like to thank you, Ms. Bích Hằng, for introducing and bringing the RESPONS project in Thái Nguyên. And I'd like to thank you all the line ministries and departments, the sectors from the province to bring the project here to the province. I would like to wish you all good health and happiness and wish the project to be successful. Thank you very much. Thank you, Ms. Vũ Thị Phương Thảo, for your sharing. Ladies and gentlemen, throughout the program, we have listened to the sharing and introduction about the project from MSI Vietnam. For the project to be implemented effectively in the province, we are looking forward to your questions and sharing in the events now. And do you have any questions for the project team now?
So many information about the project, and now it's time for the Q&A session. We hope that we will receive many questions so that you will have a better understanding and deeper and more detailed information about the project, so that it will be very helpful, useful for our collaboration. Và xin mời các quý vị đại biểu, các quý vị
Ladies and gentlemen, if you have any questions, please provide your question.
Chúng tôi đã nhận được một câu hỏi đầu tiên ạ, xin mời.
Xin chào tất cả mọi người có mặt trong cái lễ khởi động dự án ngày hôm nay.
Good morning, ladies and gentlemen. I am from the Si Sum Sen TV now, Federation of Labor, the trade union. I heard you introduce about the project. What are the activities in the project? So I would like to have a question. When we come, for example, when we register for the project to come to our factory to support us, then can the support be done in many times? Like in our factory, we have workers working in the day shift and night shift, for example. In that case, we can receive your services in several times or just once. Thank you for your question, which is very practical. According to our experience with many factories in Vietnam, we see that for all activities, in order to be successful, the project activities must be flexible and it can meet the needs of the production of the factories. Only in that case we can receive support. And your question is exactly the thing that we always work and care about when we work with the factories. So we can agree, for example, on the time, the most suitable time for the workers. For example, in the factories, there are high season and low season of work. So we are very happy to work with the factories if we have an opportunity to do so. I think the relationship here is two-way communication. So we need to seek for the consensus and agreement from all stakeholders. And based on our experience, we think that we have to do communication first, and we inform the workers first so that they prepare and they can prepare before they receive the services. Later, Miss Kim Ian and her project team, they will work in detail with the factories on how to support.
Xin cảm ơn Madam Nguyễn Thị Bích Hằng.
Thank you, Madam Nguyễn Thị Bích Hằng.
Những câu hỏi tiếp theo.
And do we have any other questions?
Xin được kính chào các anh chị ạ.
Good morning, ladies and gentlemen. My name is Lê Văn Thăng. I am the chairman of the Samsung Thái Nguyên Trade Union. Firstly, I would like to thank you, the Provincial Federation of Labor and MSI, for organizing a kick-off for the project. And we hope that we can enjoy the services from the project. In our company, we have pretty many workers, and women accounts for 70%. And we are caring a lot about the healthcare of the workers. We have 2 health stations and some doctors, and we also provide a periodical health check for our workers. In addition to that, we also have a team of people who provide frequent counseling and support for women, especially female workers. They are the psychological supporters, or another one is the health project. They work on the healthcare, especially reproductive healthcare, female healthcare, and some sexual related disease. And also we have around more than 300 people, the gatekeepers, the collaborators, the gatekeepers at the factories who work directly, who come into direct contact with the people who have some health issues or the GBV issues. So we like to propose that when if we can access to the project, we hope to receive more counseling and support so that we can receive more support from you. For example, it can be the it may be difficult for us to conduct the communication between our company and MSI because we are a production company, so we have to organize our workers to work in many shifts. But I propose that we can collaborate through our workers, like the psychologist or our health keeper at the factories, to work together with you. And actually, since 2018, we organize separate trainings for these staffs, these collaborators. They will be the focal point to communicate to our workers later. And also, we hope that in this year, we can have further collaboration with MSI. And we hope we can receive support from you because we are severely impacted by COVID pandemic. Thank you for your sharing. Actually, MSI, we tracked for a long time and we intended to work with Samsung in other locations because we know that just like Adidas or Nike, Samsung is a big company in Vietnam. And the garment and the electronics or the leather companies, they have the similar characteristics. And I'm very happy that today you share about the activities that you have done. And I know that for big companies, they care a lot about the health conditions of their workers. And I just want to share a model that we work with Paul Chen. cold chain is one of the companies producing the leather shoes, which is about 200 million products to the global market. When we work with them, when we first contacted them in many years ago, we also work with them and we see that there are many difficulties for the healthcare of the workers, and as Ms. Kim Yen said, the unwanted pregnancy rate is very high, like 30%, and the number of children born without a father is also very high. And when we first started this program, the province, they see that I'm so sorry, it's very difficult to hear from the meeting room. We see a reduction in the unwanted pregnancy, and it was mostly because of the awareness of the workers and the access to the family planning services. Previously in the enterprises, with some brands, they propose not to provide the on-site services like the early testing for pregnancy, some factories, they do not want us to provide such services because, for example, they are afraid that if the workers is detected to be unwanted pregnancy, then they can fire that worker. So they do not want us to provide such services. And then we worked for many years with them, and we see that their production schedule is very tight. So we piloted a peer-to-peer educator program. We select 1% of the workers in the factory, and we trained them on very important contents on the SRH, and they can share with their peer workers in the chain, in the line. And you say that in your factory you have 300 gatekeepers, right? So the model is pretty similar. We provide trainings for them, and we supported them in the activities in many years. And we can see that after a while of implementation, the unwanted pregnancy of the factory has reduced from like 35% to 18%, though it's still very high. There is a practical aspect in that when they provide the products for the Adidas, for example, then the brands, they would like to learn about the programs implemented for the workers. Like for the big brands, they have a core rank system to score the suppliers. For example, for the enterprise providing good services for the workers, they can be given with the score like 5 score, 10 scores, and at the end of the year they will calculate the total scores. And for the factories with higher scores like that, these suppliers can be contracted again in the coming years. And also, if the brands, they would like to expand their markets to have more products, then for sure these suppliers, these factories can be given with priorities. So we see, so the enterprise, they may see that well, when they take care of their workers, it's not only to benefit the workers, but also they can support the enterprise a lot. For example, before the project, for example, Pochen, they used to have a lot of strike. Like in a day, if all the workers strike on a day, like it can cost the factory 1 million USD. So when we implement the project, we also provide them with support with the peer-to-peer educators. And these peer-to-peer educators have the project and the factories to communicate on the site. Just like with the case of Samsung here, in the Poland, in the south, they have a very big factory, 60 to say, and they also have a health facilities of 60, 70 workers. But the rate of treatment is very low, like 30% of the capacity of the health workers, even though they can provide those health services there, but they can refer their workers in trouble to other facilities. So if we see that if we provide services for them and we increase their capacity, then the workers do not have to go out frequently to get access to further services. And each year, I think they can save 700,000 or 1 million USD. Maybe for the big corporation like Samsung, then 1 million USD is nothing. But if you can save that money from the social insurance fund, you can claim this fee from the social insurance fund. So I think you can save more. And even the workers, they have less reasons to strike because they are satisfied with the working condition, right? With the project contribution, we can use a lot negative consequences for the enterprises. However, we need to get the commitment and investment from the enterprises to let us to join. And from MSI perspective, we guarantee the right to selection for women. So we are very happy to join and to collaborate with you and Samsung, the representative from Samsung, and we are looking forward to an opportunity to work with you. Thank you, Ms. Nguyễn Thị Bích Hằng. I'd like to thank you, Ms. Nguyễn Thị Bích Hằng, for your feedback, and I hope that after today we can reach more to MSI and we can discuss further on how you can support Samsung. It's wonderful. Today we see a lot of concerns and attention from our guests to the program. I have a question for Mr. Dũng. Initially, when I first met Mr. Dũng, you mentioned about some live stream events with the trade unions, with the trade union members, and we see it's very interesting. And I do not know what happens to the grassroots trade unions, but I think we can have a vision and we can make use of the technology in this new era so we can bring more innovation to our workers. So I hope that Mr. Dũng, can you please share more about your activities like this? Dear Ms. Hằng, currently, Thái Nguyên Trade Union is focusing on the activities like propaganda, closely linked to digital transformation, because you know the pandemic happens complicatedly. While the trade union activities, if we cannot gather them in a large group, then it can limit a lot to our activities. That's why we have been flexible from in-person crowd meetings into the online meetings. And nowadays, the provincial and the local Federation of Laborers, we are now investing in the equipment for digital transformation so that we can organize the meetings to communicate via online social networks. Recently, we have organized many live streaming events to communicate, especially communicating on the healthcare services for workers, especially the pregnant women or women raising young kids. And recently, we also provide counseling for healthcare for the workers who get contracted with COVID and healthcare after COVID. And in Thái Nguyên trade union, we have pretty many, or in Thái Nguyên province in general, we have pretty many doctors, and we can also train doctors here. That's why making use of the Thái Nguyên benefits and advantages, we seek for the support from the doctors in hospitals in Thái Nguyên to support us. And if today we can collaborate with you, with MSI, then we can further promote our communication via social networks. So on fanpage of Thái Nguyên Federation of Labor, every day we have 1,400 to 1,500 accessing or visiting our website, our fanpage. And we will promote our fanpage into See Thái Nguyên page, because in Thái Nguyên we have a See Thái Nguyên application, and all the local provincial government agencies access to See Thái Nguyên application. You can download the See application, so you can see everything is posted there, like the province guidance or directions. And we have a high number of followers. And since the 20th of April, we will put it online, and currently we are now adjusting our e-portal. Talking about the grassroots level trade union, the rate of trade union members who use smartphone is very high. So when we communicate through many methods like live stream or other methods mentioned by Mr. Thang, we can, for example, when they send us with the questions, then we can arrange different types of feedback. Because sometimes the workers, they do not want to share about the sensitive issues. They just want to talk to the counselor only. And when we do that way, we can keep confidential their information, and the workers who would like to seek for more detailed information, they can discuss with us privately. And we will discuss with our senior agencies to instruct so that this model can be applied and workers can have access to this model in the easiest way, in the most convenient manner. That is the expectation from the Provincial Federation of Labor. May I ask Mr. from Samsung? The health treatment for women. Each year, the enterprises having female workers have to assure the women's health workers checkup, like the gynecological examination. How are you doing this?
Vâng, thưa anh chị, là ở Samsung chúng tôi thì như phần đầu đã chia sẻ, chúng tôi
Samsung, as we shared from the beginning, we care a lot about the health care of the workers. So right from the beginning, we check their health condition right from the beginning, and also we assure the periodic checkup. Not exactly, but I remember there are about more than 40 items to be applied in the health checkups, including the reproductive health care. In 2021, even in COVID, we have a health station in the factory. With COVID, we faced difficulties, but still we tried to follow the regulations. That is one time of health checkup for a worker, at least in a year. In our health station, we work together with the occupational health services institution and the hospital A of Thái Nguyên. And for the two health stations, we have nearly 60 nurses and doctors working 24/7 to assure health condition for our workers. Ladies and gentlemen, I am the chairwoman of the trade union of Sun Walnut company. We have nearly 1,000 female workers. In order to join, if we can join this project, then what should we do to better improve our communication and to engage our female workers to enjoy the reproductive health services? As Ms. Bích Hằng, you shared the project team. We have Ms. Ninh, the coordinator. Then after today's meeting, our staff will contact directly to the agencies who register to join the program for detailed activities. Our staff will collaborate directly with you, especially with the grassroots or the factory trade unions to implement the project activities. And for the workers, before the events and before the health service provision events, we will communicate about the activities to the workers based on our experience. Then the trade union of the factories can communicate via the loudspeaker system of the factory, or the trade union or the human resource staff can use the leaflets or share information via the bulletins to the workers. And through this project, we also provide you with the standees, the posters to be put into the factory, into the pantry rooms where many workers can access to information. So they can access to our information and they can get the e-voucher QR code like I presented before. So when they use the e-voucher code, they can use that e-voucher to register for their health check. And for example, in that case, whenever we organize a mobile health checkup, then they can come to our events to receive services. Good morning. My name is Hương from RESPONS Thái Nguyên in Điềm Thụy Industrial Zone. I have a question. When we register for the health checkup services, then after checkup, if there are needs for treatment, or if then how can we contact with the doctors or the project for further support? So after the checkup, the workers, after they register to attend the checkups, then if there are more needs like further counseling or treatment of disease, then how can they contact the project? As presented in my slides before, I clearly said that the service providers in our mobile checkup events, they are doctors and nurses, the specialists in the reproductive health care. They received the certificates to act as doctors and nurses to provide services. And after the checkup, and if workers they detected some disease, they can call the hotline. The hotline 1900558882, so they can receive further support and guidance from the hotline operators. Or even during the checkup events, if they need, they can have direct contact with the doctors, because if they need further or in detail counseling services, then we are willing to support. So in this material package, there is also a registration form. For you, representative from the trade union of the factories, please register your information and send it to the women's department under the provincial federation of labor, and then they will share with the project later. Your question is very important. That is, after checkup, or after treatment. You see that sometimes with some examination or some testing, then it takes time to get the results. So on the website, you have a QR code, right? Each person, each client, or each customer will receive a different code. Then we can send you results via that code. For example, you can access to your account with a different code, and you can access your test results later. And even after you receive test results, if you still have questions, you can call to the hotline of MSI. MSI, we have a pool of the SRH doctors with good expertise to answer you in more detail. And I think there's another question from you, which is very fundamental, right? What next, right? I think it's very important that the factories, if you would like to join, please register with the Taiwan Federation of Labor, and then we will work with them and we will calculate to see how we can allocate our resources to different factories. But the focal point in the province will be the Taiwan Federation of Labor. You can contact them first. I'd like to explain further to your question. For example, during a checkup, if the doctors find some disease of the worker, then what will happen in terms of treatment? And for sure, when there are disease detected, then they will prescribe you with the medicines. So in my slide, I already mentioned that due to the needs like that, we also provide on-site treatment services. And even, for example, if on that checkup days, all the needs cannot be met, then these workers can bring that prescription to another hospitals or health stations for further treatment, because with our services, we focus on detection of the disease or any health problems so that they pay more attention to their own health.
Vâng, không biết còn quý vị khách mời nào còn có câu hỏi muốn gửi
Do
cho.
we have any other questions for the board of organizers?
Dạ vâng, có lẽ là rằng là sau buổi ngày hôm nay thì nếu quý vị
I think that after today's event, even if you still have further questions or comments to the project team, then you can send direct your questions to the board of organizers. And we welcome the cooperation and attention from all of you. Thank you very much. Ladies and gentlemen, this is the part of our registration to join the project, and this has marked at the end of the opening ceremony. So on behalf of the board of organizers, I'd like to thank you for your presence in the event today. I hope that you can join us in the future. Wish you and your family good health and success and further development in your company.
Ceremony of the RESPONS project has come to an end. Once again, we would like to say thank you to all of you for attending this special and meaningful event with us today. And outside of the auditorium, we will serve tea and also sweet cake. So we would like to invite all of you to enjoy our small party. Và sau đây thì xin mời các quý vị đại biểu khách quý.
Now, I would like to invite all of you to come to the stage for a group photo to have a group photo. Please come to the stage.
Xin mời các quý vị khách quý.
May I invite all ladies and gentlemen, please come to the stage for a group photo, please.
Xin mời các anh chị hãy bỏ khẩu trang ra. Dạ. Xin được cảm ơn các quý vị đại biểu khách quý, và sau đây xin mời
Thank
các quý
you,
vị.
ladies and gentlemen. And now I would like to invite you to the outside lobby to enjoy tea break.